Oh, is it on?
Oh, hello.
Okay,
Hi.
I mean, we're just going to get started at some point.
Yeah.
Just to let everyone in the audience know, we're recording on YouTube, and then this is also for the Neurotech Society's podcast. So we'll just do a little spiel about that as well at the beginning. But yeah, nothing the audience needs to do, just FYI.
Okay. So hello, everyone. We are Alphabets. I'm Asha,
And I'm Anish.
and
This
we're
is the
recording.
third episode of the Imperial Neurotech Society's On the Mind podcast. Today, this is at Amplify, an event in collaboration with Imperial Radio, and we are lucky enough to be joined by Dr. Chris Timmermann.
Nice. He's a research fellow at the Imperial Center for Psychedelic Research.
And also is part of DMT research group focusing on the neuroscience and psychology of potent psychedelics like DMT, toad, cannabis is not necessarily psychedelic, but obviously it's something you guys research there as well, LSD, MDMA, the whole shebang.
Yeah.
And we will talk about all of them.
Yeah, exactly. So we'll jump straight in, because I know we don't have too much time. So do you want to give us a little introduction about the kind of work you started off, where you started off, what inspired you to come into this field of research?
Yeah. My background is psychology, a bit of philosophy as well. I've always been fascinated by the mind and how the mind works, and that led me to study psychedelics. I was fascinated by drugs really from a very early age. I thought it was quite incredible that you could have a chemical compound that could change very radically the quality of your perception, your attention, your emotion. And so, yeah, I mean, that was really where I started. And I did my bachelor's in Chile, and I hail from South America, so that's where I'm from. And in Chile, we have a specific, interesting scientific tradition where there's a lot of consciousness research that is very particular. There's a specific view on how nature makes emerge eventually the mind in the evolution of nature and the human beings. And a lot of that has to do with a specific mix of, Latin America as a country, as a continent that is the house of Western tradition mixed in with an indigenous tradition. And so psychedelic use is a big part of that. And so from that, I went into neuroscience in my 20s and eventually landed in doing a PhD in neuropharmacology, neuropsychopharmacology, where I studied the effect of psychedelics in the brain. And I did that. I ended my PhD in 2020. So I've been a postdoc for 5 years now, and we developed the DMT research group as part of my ongoing studies, and and my focus have now shifted from psychedelics to the broader idea of consciousness, understanding the mind, using these drugs to understand the mind. And so my interests really haven't changed from my initial impetus to understand the mind. They've just shifted a bit, and also linking it with advanced meditation. So that's a bit what I'm doing now, understanding how advanced meditation and psychedelics can provide certain insights about the mind and the brain.
Amazing. I wanted to follow up on what you said at the beginning about just a general interest in how drugs can sort of change our experience of the world. As a, let's say, beginner to this space, how would you describe what makes psychedelics different from other drugs? Why would, cocaine obviously does impact the brain to some extent, but what is it that psychedelics do that change the experience so much, and what makes them so profound in that aspect?
Yeah, I mean, it's something that we're still really trying to understand. The most straightforward way to understand this, I think, is that if you take your normal drugs, you would have excitatory drugs, drugs that stimulate arousal, that make you wake up or make you more, excited. Cocaine, for example, increases arousal, wakefulness to a maximum state, to a very high degree. And then you have drugs that shut things down. And this relates to our broad understanding of consciousness in many ways. And so what psychedelics do, they kind of shift things in a different kind of axis, which is about both the amount of stuff that you experience, the richness of your experience, the amount of contents you experience, but also the quality of those contents. And so one thing that happens in psychedelic experience that we don't fully yet understand very well is this idea that the experience is meaningful. And when people have a lot of this experience of meaningfulness, experiences of awe can arise, or seeing a lot of things under a single perspective. And me and a lot of other researchers think that this is one of the primary mechanisms of why they may be useful for mental health. And so this puts the experiential quality of this experience apart, sets it apart from something like cocaine or caffeine or an anesthetic drug or alcohol. Yeah.
Cool. Early on, you mentioned kind of wakefulness and also consciousness. How do those two things link for someone who doesn't know enough about wakefulness? And then my follow-up question was, at the beginning, you said advanced meditation, and that's kind of interesting. And what kind of research have you done in that space? So just two questions there.
Yeah. So the first is wakefulness is essentially, this idea, when we think about consciousness research at its most fundamental level, we think about, very simply, human experience. The fact that we have an experience at all, the fact that we are somewhat aware of that experience as human beings is also part of this idea of consciousness. But the fact of having an experience, that what some philosophers called qualia, the feeling of having an experience, is something that feels to be quite uniquely special in human beings and other mammals, especially evolutionary advanced mammals. This is where you can find this, very likely. We don't know for sure. And so drugs are a way to experiment with this. If you're interested in the mind, drugs are an amazing thing to try to perturb the system in various ways, as many of you scientists here are very aware. And so if you have human experience and you're interested in perturbing it in different kinds of ways, and more than that, if you're interested in something like, what is it all about, the richness of human experience and so on and so forth, I think psychedelics are particularly prone to that. So just hinging on something here, bracketing off, another part of the research that I've done is understanding how, for example, psychedelics can shift your beliefs, your worldviews. And what we found was that, indeed, psychedelics appear to shift the way that people think about the nature of reality or the nature of the mind. And so there's something about people engaging with these experiences that somehow make them reflect about the fact of consciousness, the fact of human experience. And so it's an interesting sort of mirror, it seems, for human beings. That's one thing. That leads me to the other thing of advanced meditation, that in a way I tend to conceive more and more that the way that people take drugs, or the way that we conceive drugs in in our Western culture, is this very passive thing. You just take the drug, and then it has an effect on your receptors in your brain, and then you have a desired output effect, right? And this alcohol is the best template for that. But many also antidepressant medications also have that sort of, so that's the way that we relate to it. One of the things that I think psychedelics really pose is that drugs are really an active experience. They're a skillful experience. If you look at the way that psychedelics were taken by indigenous peoples, you find that there's a specific set of practices, a specific way that the music is employed. And the same is true in certain ways for Western contexts where psychedelics are used, in raves, in which the music is used in a specific way, and the way that the culture has learned how to take drugs and the dosages they take and so forth and so on. And so there seems to be something about doing this experience in a sophisticated kind of way. And another parallel of that when it comes to consciousness is meditation. Meditation is an active practice that requires the development of a trait, of a skill, like a jazz musician that takes many, many years to develop a good understanding of their instrument. It's very similar with the advanced meditators in trying to understand their mind. And so the question has been posed for quite a long time that it is likely, it is possible that somehow advanced meditators reach a similar state of mind and potentially a state of brain as people taking psychedelic drugs. But this has not yet, there's no really proof of that. And if so, what is that similarity, right? And so this is what I've started to do, really. Started to develop frameworks for us to understand these altered states under a common framework. We recently had a llama participate in one of our studies. We gave him a high dose of 5-MeO-DMT, which was pretty interesting. 5-MeO-DMT is a particularly potent psychedelic substance, and we measured his brain waves. We're starting to map these advanced meditative brain states in the fMRI scanner and see how they relate to other drugs and other neurotransmitters. And so it all comes under this umbrella of, what you might call ordinary consciousness and what's at the margins. And my intuition is that the more we glean into what's at the margins, the better our resolution is to distinguish between these states and also what we might get from them. How is it that human beings can benefit from them? And then ideally also understand their skillful employment, that there is something about knowing how to do this in the right way so that these experiences are safe and hopefully beneficial.
And on the measuring of brainwaves front, I presume that is where you get the most quantitative data as to, the actual genuine things that make it less of a stigma and then help, obviously, the government understand and other bodies understand what they actually do. On the neurotechnology side, what kind of recording would you want to get that could aid your research the best? Are you looking for specific spike patterns within the brain that can help you unlock these mysteries? Have you got an opinion on what kind of data you're missing to help piece together the last piece of the puzzle?
Yeah, I think, I'm assuming there's an advanced listener, okay, whatever
All
kind.
backgrounds, honestly, all backgrounds.
I think, laminar fMRI would be something that I'd be particularly interested in exploring with psychedelics. With laminar fMRI, I'm now assuming people know what I'm talking about with a bit more specificity.
Just very quickly, one sentence as to what that technology involves.
Laminar fMRI, like high field MRI, high field strength MRI, essentially is, when you have fMRIs, the degree of your field strength, the potency of the scanner allows you to have a given resolution. And so high field MRI is a much bigger magnet, like 7 Tesla magnets. And that grants you the possibility of looking at the specific laminae in the brain, so the layers that make up the different levels of brain organization and the hierarchy of brain. And so that allows you to look into connectivity patterns between the brain. For example, there's a popular idea that psychedelics somehow disrupt the hierarchy of brain organization, brain function. If you have laminar MRI and you get very good participants who stay very still so that you get good data, you could start probing into these theories and try really assessing what level of this hierarchy really gets shut down and how does that happen and how that relates to experience. So that's one of the things that I think be pretty cool, laminar MRI. The other thing is these OPMs, optimize pupillar magnetometers, I think it's called.
Optically pumped. Yeah.
Pumped, oh yeah, optimally pumped magnetometer, yeah. And so, I mean, it looks cool. I don't know how good the data is. It's very little people who are using these now. But, going back to this idea of the skillful understanding of these experiences or any altered state, all these experiments that we are carrying out with brain imaging, they're in a scanner or in an EEG, but it's essentially a resting state of the mind, where if you have stimuli, it's a very simplified form of stimuli that people are having. And so if you would have things in a bit more of an ecological condition, you would get a better sense of how it is that these drugs really interact with a broader realm of the human repertoire. And by that, I mean more specifically, action. We're always acting in the world. And that is very true also for how people take the drugs. They're not just still or static all the time. They are moving around, and those actions matter. And so, yeah, something that is more ecological would be great.
I'm curious, is that a thing that's already happening? Are there scientists giving people LSD and watching them walk around in fields and interact with cows? Is that a thing that currently exists in the scientific world?
Well, I don't know if I can talk about it, but some colleagues at UCL, I'm now moving to UCL as well, but some colleagues at UCL are they build a giant maze, human maze, and I think they're thinking about giving them magic mushrooms and see how they, interact in this. Like people who go to museums and take drugs sometimes to enjoy the art a bit more. Something similar. The human maze and with psilocybin, sounds pretty cool.
You talked a little bit about action, and then
Yeah.
also you talked a bit about kind of indigenous systems of taking these drugs and seeing the response of those versus Western systems. So I think what's a little bit unusual here is you're not speaking to a bunch of just researchers, right, or scientists. You're also speaking to a bunch of young people,
Yeah.
including us.
Uh-huh.
So in terms of action and almost experimenting as
Yeah.
well, is there anything that you would, wish you would tell your younger self about experimenting or understanding consciousness through psychedelics, or obviously not encouraging or anything, or saying anything controversial, but at the same time, what would you say to this young crowd?
Well, I think, first, I really also want to clarify. I mean, I don't think that psychedelics are necessarily something that cures everything and that they're necessarily amazing or anything like that. I think, all drugs are like tools. And again, going back to the point of action, it's how people use them, that they could benefit from them. And so, yeah, that's important just to mention that. And the research is still figuring out the harms and the benefits and all these things, which are very important, the clinical research. I think for young scientists, I think the first thing is don't be scared about other people knowing more than you. I think that it's a massive waste of time. And the way that it works is that the field of knowledge and the specification of knowledge is so vast. There's so many different avenues, and people who know a lot about something don't know much about all the other stuff. And so everybody's a bit in the dark. And I think in general, I feel that science is a space to learn. And learning is an enormously joyous activity and should always be a joyous activity. And so I would encourage to go back to that disposition and that initial motivation to try to, stay excited and stay motivated and, stay more on that side of the enjoyment of learning and the challenges of learning rather than on the fear that can come along with all the competition and all that kind of stuff that happens sometimes in science. It can be a bit nasty. So that's a very generic one. And then try to get the right mentors. Try to be associated with people who are interested in your development. Try to be associated with people who really want to teach you something. Try to be associated with people who are inspiring rather than just, driven by career outputs and so forth and so on. And have a growth mindset. You develop these things. You're not born with them. And if you're fascinated and you love something and you're passionate, I think it will work out for you. That's my general sort of, philosophy so far. I don't have a position yet, so we'll see.
Do you think the majority of people you've met in academia are driven by that passion, or it's I presume the same as you would get in most industries in terms of it's a mix of people that sort of fell into that because that was the easiest path and the people that think that is their life's mission. In the Center for Psychedelic Research, do you find that it's a lot more of the latter, people that just genuinely want to solve the mind-body problem to some extent?
It was like that, I think, a few years ago. It was really just, the people that were in it were really driven by this curiosity and this aspiration to understand things and learn things, and also learn something that we're pretty much in the dark about until very recently. And so I do think that was the case. Now, things have shifted a bit more, and we have much more people who are driven by making a career in science and finding this a topic that is interesting or of interest to many people, and therefore they want to understand it and explain it a bit better. And that's also very valid. I don't think that there's necessarily just one type of motivation. There could be many different types of motivation.
Yeah, I think we have time for one more question. And do you want to go for it? I know it's your
I think, we'll steer
baby.
it more philosophical very quickly
Yeah.
then, because I think we have to wrap up, unfortunately. So given that the nature of your work is very much at the heart of the body side of understanding the physical state of the brain and imaging that, and then also the mind part in terms of understanding subjective experiences and how the experiential aspect of the world changes when you take these sorts of drugs. How do you think your perspective on the mind-body problem has shifted since you first got interested in the field to now effectively being an industry forerunner and explaining it to students coming up?
My mind-body perspective, I don't know if it has really shifted that much. I think, I mentioned the Latin American Chilean tradition on the science of consciousness. I feel I resonate quite a lot with that. And that perspective essentially states that, the mind and the body are things that we should consider with equal importance. Right now, if you think about the understanding of the mind and how it supposedly emerges from the brain, we don't have that bridge. That bridge hasn't been crossed. It's a hypothesis, is a very good hypothesis. And so, but that bridge is very important, right? And it's fundamental because the mind really is the primary source of data that we have as human beings. And all the rest is really a guess. And so we cannot really, I think, take the mind to be an epiphenomenon of brain activity yet. Maybe that will come when we have more more understanding. But so far, the hard problem of consciousness relating human experience with natural stuff and biology is still very much something that is not solved. And so until we do that, I do think that our models should incorporate experience with equal level of rigor, and we should try to make a push to understand the mind as well as understanding the brain in equal fashion.
That's brilliant. Well, thank you so much for being our guest today on the Mind, Chris, and at Amplify. And thank you to everyone for listening and to tuning in. So thank you very much.
Awesome. Thank you, guys.